Welcome to the Cancer Support Suffolk podcast. Join me, Mark Murphy, and my brilliant guests as we talk about life before, during and after cancer. Hello, I'm Mark Murphy, the CEO of Cancer Support Suffolk, and welcome to our latest podcast, supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. This month, we're looking at cervical cancer. With me is Hannah Ismay, who's lead nurse of the very important Information Project, and Becky, who herself has had cervical cancer. Thank you both very much for joining us this month. And Hannah, it's been a busy few weeks. Lots have been in the news about cervical cancer, but start by just telling us what it is, first of all, if you can.
Yeah. We have had a busy few weeks. Obviously, last week was Cervical Cancer Awareness Week, and cervical cancer is obviously a cancer that affects the cervix, which is of a part of the body located above the in the vagina at the top where it meets the uterus.
And is it a common cancer?
It is it's the 14th most common cancer that people in the UK or people with a cervix in the UK will have. So it is sort of relatively common.
And you do everything you can to raise awareness of the need to have regular checkups.
Yeah. So our whole project is based around trying to raise awareness, try and work with different targeted groups. We know very much that there is particular groups that don't always attend due to different barriers. They can be very individual to different people as to why that is. So our project really does concentrate on working really hard and differently to try and target and raise awareness and give support.
What are the reasons that people give then for not attending their screening appointment? What do they say?
So they can be really, really varied, actually. Some of the main barriers that people will face will be things like embarrassment. I think people have heard of maybe bad experiences. I think we're all guilty that if we've gone for sort of a good cervical screening, that's not the sort of thing that you talk about or you hear about, but you'll hear people talk about a bad experience or it was uncomfortable or it was embarrassing. So I think there is definitely that element. Alongside that, I think we're really, really busy people. We are often working, so time to get appointments, contacting GP surgeries, however, whatever is difficult. It takes up time. We have other commitments as well, don't we? So whether we have young children, family, things like that do make a difference. It's not always easy to get an appointment which suits people. So that can definitely be a big barrier to people attending. But it is much more than that. So the project looks really into those sort of groups that aren't attending, multicultural for one. So if English isn't your first language and you come and you get one of these sort of invite letters, it's quite long and wordy. Actually, if that's not something you're used to perhaps in your own country, then it's something that you're maybe not sure of. You don't have that education around it. So that can obviously be a barrier. Also, with that sort of learning disabilities, mental health groups, we know that there is, it's difficult for some people within those groups to attend for appointments. So we do have sort of much more targeted work we do with those groups. Trauma, sexual trauma survivors as well. Obviously, coming for something so intimate as having cervical screening can be really triggering and can be really, really difficult. So that can obviously be a huge barrier. But that's not an exhaustive list. There's many, many reasons. I would say education is one of them. People don't always talk about cervical screening. You may not have heard of your mum or sister or auntie. They may not have talked about there's something that they do. So people don't always think it's necessarily appropriate for them.
So it needs to be much more commonplace, talked about. Yeah. Part and parcel of life.
Yes.
It's time to go and have my smear test.
Yeah.
Like going to the dentist almost in a way.
Yeah, exactly that. It's that self-care, isn't it? It is like having some other health checkups. It shouldn't be a taboo about it. So it definitely isn't spoken about enough.
And Becky, you went for a test. So you had the letter come through, did you?
So I've been for my tests every 3 years since I've been 18 when I was young, and then I think the age has changed now. So I would go regularly. They were all fine. I had one unclear, which I had to have retaken, but that was fine. I had my son in 2011, had a smear a couple of months after that, and she said, you've got a bit of cervical erosion, which I didn't really know anything about, but she said, that's not fine, just go away, not worry about it. 3 years after that one, I went for my regular smear and I got a letter saying it had come back as SIN 3, which is severe changes, goes from SIN 1 to SIN 3. So I had to then go to the hospital to have. I think they automatically thought that they were going to do the LETS treatment, which is where they laser off some of the cells, so burn off some of the cells. So I had that done, and that then came back. I got a letter saying you need to come and discuss your results, which I did, and that's when they said they'd found cervical cancer in the part that they had taken off. It was very small. I think it was stage 1A1, and when I got the letter, it was less than 0.1 millimetres they'd found. They then offered me, they said, you can go away and then come back in a year, or you can have another treatment just to make sure, which is what I did, and that came back all clear. So I was saved by the bell, really, by going on my 3 years. Really.
So for you, the fact that you went for regular screening, this was picked up really quite early on.
Yeah, I mean, even the doctor said you were saved by the bell, because I'd been 3 years earlier and it was normal. And they say it's a slow-growing cancer, but my cells had changed enough within those 3 years that if I had missed it for a year or a couple of years, who knows what would happen.
And did you question about going to get your smear tests when the letter came through? Did you think,
Not really, no. I was pretty good at that.
Yeah.
You'd put it off for a couple of weeks maybe, but that's maximum. No, I would definitely go within that year, I would be there.
And knowing what you know now, what would you say to people who get that letter and think,
It's so quick. It doesn't take long at all. If you go in and try and relax, it's not so painful a lot of the time. Obviously, there's times where it's a bit uncomfortable, but it's a couple of minutes, and it saved my life. And it probably save a lot more if they go on time.
It's fascinating, Hannah, isn't it, hearing Becky's story there? So you hadn't got any idea?
I had no symptoms whatsoever.
Nothing whatsoever?
Nothing at all.
You're nodding away, Hannah.
Yeah, and that is the thing with cervical cancer, is actually there isn't always symptoms, so people don't always necessarily know. There are, in some people, they may have some warning signs, things like bleeding in between periods, sort of pain with sex, any abnormal discharge, but also these things can also be signs of other things as well. And it is really difficult because, like you say, you didn't have any signs or symptoms. So I think sometimes people think, oh, there's no problems there. Like, I know I'd have, if I had an issue, there'd be a sign. And so they kind of do sometimes put off it. They don't prioritise it. Like, you obviously found Becky. It is so important to go. It isn't something there are symptoms for. HPV is the cause of over 99% of all cervical cancers.
Yeah, talk to me more about HPV.
Yeah, so HPV is a virus. There's sort of over 200 different types of HPV. There are some which are sort of low-risk strains that may cause no symptoms or sort of low-grade symptoms. Genital warts, for instance, is a type of HPV. But there are a few, about 14 high-risk strains of HPV, and these are ones that could potentially become cancerous over time. And it is, like Becky said, it is generally, with cervical cancer, it generally is something that is over a long period of time, often months, even decades with some people. The two main strains, 16 and 18 of HPV, are responsible for over 70% of all cervical cancers, those two main types. So what we do now, as of 2019, the way cervical screening works is that everybody that comes for screening is checked to see whether they have high-risk HPV, first and foremost, as a test. If HPV isn't found, that person would then be deemed at low risk. That would be a negative sort of result, and they would go back to their routine screening, whether that be 3 years, that's between the age of 25 and 49, or 5 years from sort of 50 to 64. If HPV is detected at that point when they go for screening, in the lab, they will do some more testing. So they will make a slide up, and that is where they have a little look at the cells to see if there is any sort of if there's any cell changes, basically. So if there's any changes to those cells. And if there are any, then they would invite you to colposcopy, which is obviously what happened with yourself, Becky. If HPV is found, but actually there is no change to those cells, what they do at that point is they would they would invite the person to come back in 12 months rather than go to colposcopy. And that is, we see them a little bit sooner, because what we do know about HPV is that the majority of people will clear it. 90% of people will clear it within 2 years, and it doesn't leave any long-term issues for a lot of people. But we just don't know who those people will be.
Is there something that we can do to negate the problems that we've heard about here? Can we prevent cervical cancer? Can we attack HPV?
Yeah, well, obviously there is the HPV vaccine.
Yes, yeah.
So that is something that is part of the sort of national vaccine programme.
And that starts quite early now, doesn't it?
Yeah, it's age 12 to 13, so school year 8. It started back with girls, and then in 2019 it included boys as well. So it's both boys and girls that get offered the vaccine. We know that actually the HPV doesn't just cause cervical cancer. It can cause vaginal cancer, vulval cancer, penile cancer, anal cancer, some head and neck cancers as well, which is on the rise. So it helps to protect against all those different types of cancer, not just cervical. So obviously using a barrier method. HPV itself is transmitted through intimate contact. Using some kind of barrier method can help, but it doesn't completely absolve that risk. And also not smoking or stop smoking. We know that HPV is something that is harder to clear if somebody smokes because it affects their immune system.
So going further down the line then,
Yeah.
will we see fewer cases presenting then because of this vaccination programme?
That is the hope, that with the vaccine programme that we will see a reduction of cervical cancer. If you look at, there are graphs that show actually the mortality with cervical cancer. And since the cervical cancer screening programme started, we've saved or it's halved the amount of people that have died because of cervical cancer. So, yeah, so it is working really, really well. And it is predicted that we will see even fewer cases. But obviously that does depend very much on people attending for their screening and obviously taking up having the HPV vaccine.
Becky, if there hasn't been a screening programme in place, this would have just been getting worse and worse and you'd have known nothing about it
I didn't know nothing about it until I possibly developed some symptoms. Yeah. I think the HPV vaccine, because when I was at school, I mean, you knew you were going to have a smear at some point in your life, but you didn't know anything about it. I didn't know anything about HPV, or I just knew you had a smear and it told you if you had cancer. And I think that now the children are getting it, and the boys and the girls, they're being more educated, hopefully, whilst they're having it. And it's bringing an awareness to them as well at an early age. I
worry that there's vaccine resistance around these days. There's a lot of misinformation. In fact, the latest Call the Midwife was all about the measles vaccine and the importance of that the other night I was watching. And I remember doing phone-ins when I worked on the radio with people who can remember what life was like before the measles vaccine. Yeah. Yet now there seems to be, because of all the misinformation around. Is it a concern going forward, that?
It is definitely. There is misinformation. And people are worried. Parents obviously would give consent for their children. And I think they've potentially a bit of a sort of, some people have lost faith and worry about vaccines. But there is a lot of really, really good evidence. There's independent, we always signpost to the Oxford Vaccine Project. HPV vaccine has been going around for many, many years. There's a lot of research and there's a lot of data to show that actually it is working. Public Health Scotland early last year reported that they haven't had a single case of somebody having cervical cancer that have had their vaccines.
That's amazing, isn't it?
Yeah.
I think people have probably been jaded a bit by the COVID vaccine and how quick that came out, whereas the other vaccines, I know they have years and years of work go into them, and people just remember the COVID one, so puts them off a bit, I think.
It is a concern going forward, isn't it, really?
And my son, he's doesn't like needles, so I had to use quite a lot of emotional blackmail to actually get him to have the HPV, but he did it. He did it in the end.
And do you talk to friends? Do they talk to you about the importance of smear tests?
Yeah, I share a lot on Facebook. If I've had my smear, I'll share, and if it was a good result, I'll share that. And then sort of if there's anything in the news, like about the vaccine and things, I'll share that. And yeah, I think most of my friends are pretty good. They do go when they're meant to go, so it's working. Yeah,
well, it's great that you are happy to speak out in the way that you are and to let people know, because it's just so important. And we just, we spend often a fortune looking after our cars and bits and pieces and forget to look after our own bodies.
For an analogy, every year you have an MOT test and you don't put it off because you can't put it off, and you pay for that. But for your own body, they're giving it to you for free, and you're not taking it up, so...
Do it.
Yeah, exactly, yeah.
And tell me a bit about the work that you do, Hannah, because you do a lot of outreach work, don't you?
Yeah, a huge amount of outreach work. Like I say, some of the barriers that we find and a lot of the issues is regard to education as well. So education is really, really important. As a project, we're always trying to think of different ideas, different work that we can do to reach the public. We go out at the moment. So at the moment, Natalie, one of our nurses, is out in Clacton. We do health outreach. We have information. And actually having somebody there, a professional, where you can ask questions, talk about your concerns. We hear lots of people's life stories, their screening history. And it's really interesting that people do want to come and talk to us about the experiences they've had. So we also work really closely with the GP surgeries in Suffolk and North East Essex. We have health inequalities training that we go and speak with the clinical staff at the surgery and also the admin staff at the surgery. So the people that the patients will see like firsthand when they come in, when they're booking their appointments, when they're ringing up to book their appointments. And we talk about how we can capture people, how we can speak about reasonable adjustments, how people can make that appointment what they need, make it more holistic. Being able to ask for different things, because I don't think people feel that they can necessarily do that, and then they may well feel put off to come for screening. So with the clinical staff, we talk about best practice, trying to work with our non-responder list, so people that aren't attending, why aren't they attending? Is it that English isn't their first language? Could we potentially send out some translated materials? We've got a learning disabilities pack, which is for GP surgeries. It's something they can send out as a resource with different videos. We also take one-to-one referrals. So if a surgery or if sometimes we have it through different groups, we'll come into contact with, they will say, we've got this patient that wants to have screening, but they're a bit worried. Could you do some work with them? And we're really lucky that we can do that tailored work quite uniquely. So we can do it as that person would need. It might well be that we go and support them at their screening appointment.
Because they may have built this up into such a big thing, got into
Huge,
such
yeah.
a stew about things. You know, I'm a bit like that when I have to go for an appointment. I get myself in a right state, you know.
Yeah.
And sometimes you just need a helping hand to get you across the line, don't you?
You do. And I think the way we're really lucky, we've got such a great team, very small team, but really lovely nurses that are very good at listening and supporting. And like I say, making that exactly what the individual needs. So it might be that they want to have a look at the equipment. It might be they want to talk about what the results could be, talk about the procedure. They may just want to talk about what they're worried about and have someone listen. So we can do that with them. We can do that piece of work before they ever go to their appointment, and we can support them along the way. We do a lot of work with them. We've done some refugee work as well. So we will go and work with different groups. We've gone to work with Berry Women's Aid, so women that maybe have like fled domestic violence and things like that. So we've worked particularly with these groups to give a chance for them to speak about their worries and concerns and feel listened to, and obviously to give that support. And so very much what we do is, trying to get that message out there, but also make it known that there are things that can be done and that there are things that is quite right that the person can ask for, the patient can ask for.
And
It's easier.
Go on,
Sorry,
Becky.
is this something that's UK-wide? Because until I met you, I've never known sort of a group of people put so much effort into getting people in. Like, as far as I know, this is your time for your smear. If you can't make that time, then. But you seem to go above and beyond, and I've not really known that anywhere else.
Yeah, I don't think it's not something that is extended across like the UK in general. It's something that we started out in Suffolk, and because of the work that we'd been doing, we got extended to go to North East Essex. And we are really, really fortunate that there is funding put in place to be able to do this. I'd love to see it rolled out across other areas. I think it would be fantastic.
Amazing what you do.
Yeah.
I mean, there must be so many women out there who, for whatever the reasons you've given, aren't coming forward, and really, in the way that you did, Becky, need to come forward because you don't know what's going on inside.
No. Yeah, exactly.
Yeah, amazing. And obviously, there's lots and lots of people that you come across every single day. Do you find people that, for whatever reason, haven't gone and had their smear test, and you convince them that it's the right thing to do, and they go off and do you get feedback and say, after I spoke to you, Hannah, and Becky, likewise you as well, after I spoke to you, I've been and done it and I'm glad I went. Yeah,
we do. And actually, it's a really lovely part of the job because we feel like we are making a difference. Yeah. For us, we'd never obviously tell someone what they had to do. It's about giving them education, information and support to make that best decision. And some people will still decide not to have it done, and that is for them, and that is, we would always respect that. But obviously, it is really, really nice when you can see that the sort of light bulb flashes in some people and they actually realise this is something I need to do, this is important, and with your help and your guidance, this is something that we will do. So it is a really lovely, and I think we all feel really grateful as a team that this is something we've been able to do. I had someone recently, I spoke at an event, and they came up to me at the end and they said, I just wanted to let you know that actually I've had cervical screening, I've been referred to colposcopy, I've missed 2 appointments. I didn't really think it was that important. I just dismissed it. I've been really busy. She said, but I've got to go, haven't I? Like, listening to you, I know, I can see I've been really silly and this is so important. And I was like, yeah, please do. Please go. And obviously we spoke a bit more about how she could get an appointment and supported her to do that. And actually I was really grateful that she came up to us and said that, because without her doing that, we wouldn't have known. And so,
the early intervention detection is so important.
Yeah.
And Becky, I love the way that you nonchalantly said, oh, yeah, if I've been for a smear test, I'll put it on Facebook that I've just been and had a smear test. I think that's fantastic. Talk about openness and making it, you know.
Sometimes it's not people not wanting to go, it's just jogging their memory and they think, oh, yeah, I need to book that, just by posting one little thing.
And it does jog people's memories, seeing it, you know. We're all just so guilty of being busy and actually it's a reminder, isn't it?
Sometimes I think it's more emphasised on having symptoms, so you think, oh, I haven't got any symptoms, so it doesn't matter if I put it off for a year. Whereas in my case, I had no symptoms and it was a good job I didn't put it off for a year.
I did something similar earlier this year. I hit 60. I know you may find that hard to believe, but I hit 60 earlier this year, so I had my fit test come through, you know, the poo test in the post. I did it. It was really easy. I did a little film of me putting it in the letterbox, in the post box. We posted it up on social media, you know, and hopefully if people saw that, they would have thought, oh, yeah, perhaps I should do that, you know. So I think all of us could do more of that, you know, just make it much more normalised.
It's a social media world now. So.
It is, yeah.
We're also attached to our phones, though, aren't we? You know, so actually that's the way to get into people and remind them. Definitely. We have a social media with our project as well, so we do put videos about where we've been out and about, and obviously with awareness campaigns and prevention campaigns, we do obviously put a lot of information on there to try and
although we don't like people so much anymore, do we? So now maybe instead of sending letters out reminding you, so if you get someone on the phone, you just book it straight away, wouldn't you?
Yeah, absolutely.
You can't ignore a person on the phone.
They are looking, however, to change them, because obviously people get the letter as their invite. They're looking to change that to the ping and book service this year, so people will be sort of have a text message for cervical screening. It's going to start with breast screening.
Oh, in the way that we had for flu jabs and COVID jabs and things.
To try and make it more accessible. Okay. Yeah.
Well, you're right. The phone is with us all the while, so that's much easier, isn't it? You know, you can't stick that behind the clock on the mantelpiece and think I'll deal with that later.
Exactly.
Yeah, much easier. Look, Becky, thank you. I know you've travelled from North Suffolk to be with us today, so we thank you very much for joining us. And Hannah as well. Keep up the good work.
Thank you.
And Becky, keep posting on social media and encouraging people to go and get their smear tests. It's been really, really interesting today. So I thank you both very much for joining us on our podcast. Well, that's it for this month. Thank you very much for listening to this episode. If you'd like more information about what we do, please head to our website, cancersupportsuffolk.co.uk, or you can call us on 01473 211 884. We're based in Ipswich here in Suffolk. Cancer Support Suffolk is passionate about educating and supporting the people of Suffolk, and as a registered charity we rely on donations and fundraising to be able to continue our vital work in the community. This podcast is the copyright of Cancer Support Suffolk and is produced and managed by podtalk.co.uk, supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. Until next month, from all of us at Cancer Support Suffolk, goodbye.